Yeah.
What tells you something someone is a rapid responder, and what tells you someone is probably going to be a difficult case?
The main thing I listen for is irritability length after the irritating activity. How long it sticks around, and then how quickly they respond, or kind of like the intensity that they respond to any sort of intervention that I'm doing. So if they go from like an 8 to a 2, or if there's a session and we're trying lots and lots of different things, but nothing's quite clicking. And then I think of other things those are the main two things I look at.
Yep, that's
Yeah.
perfect.
Okay.
I would expand on that as also other things you listen for are in their previous history, which is typically the kind of patients that you and I see, right? Like people who have been to a chiropractor or a physical therapist or whatever. And we seem to be seeing a lot of people who actually are getting no homework whatsoever, right?
Yeah.
But
Yeah.
anyone who says, despite their chronicity of complaints, because everyone we're taught that like chronicity means difficulty, right? The longer the duration of symptoms, the more difficult they'll be, the more likely they are to be centrally sensitized. But that's not true. If anyone ever says, I got needle or I got adjusted or I got some tissue work or fixation or whatever, and it improved for X amount of time, right? If it improved for hours or even like, oh, I usually get relief for a day or so, that would tell me they're also a rapid responder. It's not
Okay.
only the stuff that you did, but it's how well did they respond in the past. Because the failure then is the home exercise program, right? It's the recovery plan. It's
Yeah.
not the treatment. Everyone else thinks they're not getting the right treatment, but it's really they're not getting the right program to expand the treatment, the effects of the treatment.
Yeah.